Okay, thank you everyone for joining us today to commemorate IDADA, which is the International Day Against Drug Abuse and Illicit Trafficking. We are very happy to have you join us. Now, before we continue, my name is Yvonne Orlando. I'm the Director in charge of Public Education, Advocacy, and Rehabilitation. I'd like to kindly ask the members to stand for the national anthem, followed by the East African Community Anthem.
O God of all creation, blessed is the Lord and nation. Justice the shield and defender. May we live in unity, peace and liberty. Plenty be found within our borders. Let one and all arise. Bring forth strong and true. Service be our highest endeavor. And the homeland of Kenya, heritage of splendor, from where we stand to defend. Let all with one accord, in God united, build this nation together, and the glory of Kenya, the fruit of our labor, fill every heart with thanksgiving. Mungu twaomba uilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
So I'd also request that we remain standing as we are led by prayers by Jacqueline Dama. Let's pray. Almighty God, we bless your name this morning. We give you glory for who you are, the everlasting, eternal, the Lord of all of it. Lord, even as today to remember this day, the National Day against drug abuse and illicit trafficking, we pray that the divine awareness that causes people to transform and change from the effect and impact that are negative against drug abuse. Pray the Lord God, you're going to help us. As players in this message, we know that it is a new message. The Lord will pray that by your power and your strength, we shall see the desire of having nations and societies that are free from drugs. Give you glory for this day, this place, and we're going to celebrate. I remember this day that them that are also suffering in these issues of substance use disorder, we are going to empower them and cause them, Lord, to be your mighty way. The Lord God, because of the times that we are in, there are failures, that is the times post the pandemic. And this also makes it more difficult for us. The Lord God, your wisdom and your guidance, Lord, will protect Kenya, will protect our nation, will protect Nakuru and all the other stakeholders in the campaign against alcohol, drug abuse, and illicit trafficking. We give you glory. In this we pray in the name of our Lord Jesus Christ. Amen. You may be seated. Today we are commemorating IDADA in partnership with UNODC, the United Nations Office on Drug and Crime, the East African Office. Now remember to follow us on social media. We are looking forward to your questions and interaction. And our theme is Share Pack on Drug Save Lives. For this point, I'll invite our CEO, Mr. Victor Kioma, to give us the welcoming remarks.
Thank you, Bon. Our chief guests, invited guests, ladies and gentlemen. Let me take this opportunity to welcome you all seated in this room and those who are joining from various locations within the building and indeed around the country to this the third IDADA celebration. As you are aware, this is an opportunity that UN member states take to reflect on the strides that they have made in the journey to make their nations free from the effects of alcohol, drugs, and illicit trafficking. And therefore, as a country, we sit here today to try and look at our efforts that we have made as a country, the challenges that we have faced as a country, so that we can chart a way forward in trying to make a country that is free from the negative effects of alcohol, drug abuse, and illicit trafficking. As you are aware, normally this is a day as an authority. We travel out there in the counties and engage with the communities in those counties and pick out some of the milestones that have been made in the effort to make this country free from the menace of drugs. But because COVID happened for the last, I think, 2 years, this is the way we have done it. And indeed, I realized that we still, with the COVID environment, we are still able to reach out to Kenyans through the technology that we have embraced as a country. And I want to really appreciate that we have this opportunity to sit together, not the way we would have liked it, but the way circumstances have forced us to, celebrate this day. As we reflect, and we will be hearing some of the baby steps that we have made in the journey to rid our country of the menace of drugs and illicit trafficking. I think more importantly, let us be forward-looking and see the journey that we need to travel and see where the hurdles are and how we can join hands to do this. I want to appreciate the support we have received from various partners. The county government of Mombasa, we have worked very closely, and I appreciate that you are joining us here. And we want to commit to work together because fight against the drug and substance abuse is not to be left to one arm of government or just the government. We all need to join hands. Every Kenyan needs to make his contribution in this war. I want to stop there and allow Director to take us to the next level. Thank you very much.
Thank you, CEO. So in line with our theme on sharing facts and saving lives, we want to test your knowledge on drugs and substances abuse. So I'd like to request that on Zoom or on Twitter or any of our social media platforms, as you post the question, just text if you believe it is true or it is false. So first question. Majority of Kenyans do not use alcohol or other drugs. Is it true or is it false? Majority of Kenyans do not use alcohol or other drugs. Okay, so score yourself. So we are saying it is true that according to the national survey by IDADA of 2017, 18.2% of Kenyans use at least one type of substance, with more men than women abusing drugs. So if you got it, that's 1 point for you. So our second question, which is the most commonly used substance in Kenya? Which is the most commonly used substance in Kenya? Again, score yourself. So alcohol remains the most used and abused substance globally. And of also in Kenya, with about 7% of Kenyans aged between 15 to 65 years using alcohol. And out of this, 10.4% have an alcohol use disorder. To our third question. All people who use drugs are drug dependent. Is this true or false? That all people who use drugs are drug dependent? Again, for yourself. So we are saying that it is false. Not everybody who uses drugs become dependent. The road to dependence or addiction begins with use. So as much as possible, do not start. The study by IDADA 2017, it showed that 10.4% of Kenyans have an alcohol use disorder and 6.8% have a tobacco use disorder. So our last question, drug use disorders or addictions, as they're majorly known, are treatable. Do you believe this is true or false? That drug use disorders are treatable? Again, score yourself. So we are saying that it is true. Persons with drug use disorders can get assistance in the form of counseling or therapy or medication that will support them to stay drug-free and be productive at home, at work, and in the larger society. Thank you so much for participating in our quiz. Now, again, in line with our theme, we are saying that it is important to know the facts because facts help to reduce misinformation and promote effective prevention and treatment of alcohol and drug use disorders in our homes, within our schools, our workplaces, and our communities. Our program will run between 10 a.m. to 12 noon. At this point, we are going to be looking at the achievements when it comes to drug demand reduction interventions by IDADA between the years 2018 and 2021. We shall look at them in a two-pronged way, where we look at the prevention intervention followed by the treatment intervention. So under the prevention interventions, we have positive parenting, where our focus was to the larger family. We launched media programs, both social media and mainstream media, where we targeted TVs, radios, both in vernacular and in our national languages, to be able to empower parents, particularly during this time of the pandemic. And through this media, we're able to reach 9.7 million parents. Still in prevention, we were able to partner and work with different stakeholders in the public sector institutions. We supported them by carrying out baseline surveys, coming up with workplace policies on alcohol and drug abuse, prevention and management programs, as well as facilitated training and awareness creation to the staff. In our school programs, because we need to empower children from as young as possible. So within our school programs, we were able to reach out to 19 counties. We targeted 174 schools. 289 teachers were trained to implement life skills programs and other prevention programs within their normal school curriculum. And out of this, about 12,000 learners were reached with the life skills training programs. One of our teachers from Kwale, Ms. Kadida, was able to share very proudly that the life skills training program works. Our pioneer class topped in the zone in the recent KCPE. The class had 0 cases of substance and drug abuse. So we're encouraging other schools to also take up this initiative. Also during the COVID pandemic period, we were able to launch an art and essay national competition which targeted children between classes 3 and Form 4. The theme of the competition was Stuck at Home during COVID-19. This is my story. And we received very, very wonderful turnout. And of course, our winners were awarded. We also have information booklets that are targeting children, are targeting teachers, and you also have one for the parents. Now, these booklets are readily available on the NACADA website, and they're targeting children at different ages. The idea behind this is so that as parents, you can comfortably talk to your children about the facts and not the myths as are well elaborated within the booklet. Kindly visit our website and get this kind of information. When it comes to the counseling and rehabilitation interventions that have been implemented by NACADA, NACADA has a 24-hour helpline that is available free of charge every day. We have been able to attend to 33,000 callers and be able to refer the ones appropriate and offer real-time support to the ones who need it. Out of the helpline callers, alcohol has come out as the most abused substance, followed by cannabis and the other substances. We also noted that majority of our callers are male, aged between 20 to 25. In other words, our youth are the ones who are calling to seek the most support. As part of NACADA's achievement, we have the Miritini Treatment and Rehabilitation Center, which was a presidential directive. It was handed over to NACADA officially in 2018 by the National Youth Service. And since then, as of February 2020, we have been able to attend to 268 outpatient clients who are able to also get some nutritional support. They are able to get methadone treatment, psychosocial support, and also family support in some cases. From March 2021, we have been able to intervene for 35 inpatient clients. These ones are residential clients who, apart from getting the basic support, they are also able to be empowered with life skills training. Before NACADA took over Miritini, as you can see, the buildings, the way they were looking. And right now, when you're looking at the progress that has been made in terms of the renovations, NACADA has been able to renovate the male hostels, and we are currently admitting clients. In the outpatient program, we are able to also offer medically assisted therapy. As you can see, one of our clients is actually taking their methadone. Also within our Miritini program, we have recreational activities, we have the pool tables, we have football, we have basketball for the different clientele. We also provide livelihood programs for our clients in partnership with some of our stakeholders, like the Youth Fund. We have women being trained in making carpets. We have introduced farming, like for the planting and also for rearing chicken. These are some of the programs that we are currently running in Miritini. Also, as part of the achievement, we have been able to come up with the national prevention guidelines that we are hoping will mainstream how prevention services and community are planned. So at this point, I'd like to invite the manager for public education and advocacy to give us a brief on the national prevention guidelines that we shall be launching later today.
Thank you. Good morning, everyone. Thank you for joining us. So I'm going to give you an overview of the national guidelines on alcohol and drug use prevention in Kenya. And This is informed by a journey that we started way back in 2019. And despite the COVID pandemic, we have still been able to walk that journey together with partners that are drawn from various settings. That is the workplace. We have religious institutions. We had religious institutions represented, the people from education, and also civil society organizations. So this is a journey that culminates today into the launch of the national guidelines. So what is it that necessitated these guidelines to be developed? So one, we are responding to the Sustainable Development Goal number 3 that looks at good health and well-being, and specifically 3.5 of that goal that talks about strengthening prevention and treatment of drug abuse, including narcotic drug abuse and harmful use of alcohol. We are also informed by the international standards on drug use prevention that has been supported or developed by UNODC, that is United Nations Office on Drugs and Crime, and the World Health Organization. So as an international document, we found it necessary that we also domesticate this so that we can have something that resonates with what is on the ground. So we are also informed then by what has been happening. We have many people within this country that has been doing prevention, and a lot of it has been very reactive. So you find that we want to conduct awareness campaigns. We have developed IC materials with knowledge for young people. We have used scare tactics, messages that say no to drugs. We've talked about specific substances, and we find that all these are one-time events. And we know that that cannot lead to change in behavior. So eventually we've had a situation where people are confused. People are trying to find out what they can do with regard to substance use, and everyone, in one way or the other, creating an impression or believing in themselves that they are doing prevention. So we then find ourselves in that kind of situation, and this is what we want to remedy. We want to move away from a one-size-fits-all kind of situation into what is informed by science. I'm going to take you briefly through what is in the guidelines. And the purpose of these guidelines, therefore, is to help us to establish minimum requirements for conducting effective alcohol and drug use prevention programs in schools, in families, in workplaces, in communities, and also in the media in Kenya. So I will briefly give you an overview of what you will see in the standards, which will be available after its launch. So science is informing us that we need to look at various settings. So in the standards, we are going to find that we have various kinds of settings, and one is the family. And we know that the family is the basic unit in which children are raised. And when things don't go well in the family, then we know that there is going to be trouble, particularly with regard to substance use. So when children leave the family, the next setting that they go to is the school. So children again spend a lot of time in the schools, and therefore it is also a setting that we would have programs that target them. Now, when they eventually leave the school setting, we get to the workplace. This becomes another important setting to have prevention programs. And then we also have the community-wide setting where we have policies, regulations, and even laws that have been put in place that help to advocate for safe spaces for children. So that is one of the things that we need to consider. Now, if you are in prevention or you work in the field of prevention, then we are saying that prevention programs should address risk and protective factors. And in risk factors, we are talking about those factors that increase the chances of somebody beginning to use drugs. For example, if you have a chaotic home environment, and then protective factors are those ones that will reduce the chances of somebody beginning to use drugs. For example, if you have a strong bond within the family. So prevention programs should address both risk and protective factors. They should also be age appropriate so that we move away from the one size fits all that we have been doing into programs that clearly address the various age groups. The programs should also ensure inclusivity and non-discrimination. And so no one should be left behind with the prevention programs. It is also important that the programs include monitoring and evaluation component. It has been one of our weaknesses that we do programs, but we are not able to identify what works or what doesn't work. So prevention programs should include that component so that we know what works in our environment and what doesn't work. And again, as a prevention practitioner, it's important to know that even in prevention, you can cause harm. So we need to be guided by professional ethics in development and also implementation of our programs. So briefly, I'm going to also mention some of the prevention interventions and policies that you'll find in the document. A lot of it is anchored. So if you look at our own context, family programs, we already have the prenatal and postnatal care health visits that are done by pregnant and nursing mothers. We also have the home visits that are done by community healthcare workers. We have family skills and parenting skills programs. For example, we've mentioned the positive parenting that we have been doing during this pandemic period, but we look forward to do even more evidence-based programs in that area. Then the school setting, we already have the early childhood development education programs in schools. We have the life skills programs that we have mentioned. We need to strengthen the classroom environment so that we have programs that improve that environment. The government already puts in place policies to retain children in school. Ministry of Education talks of 100% transition. And we know that when you keep children in school, you also keep them away from drugs. If the if the school environment is also kept safe. Within the school, we also need to address mental health disorders and psychological vulnerabilities. In the recent past, we have had a lot of cases where young people kill one another, those who commit suicide. Those are indicators of mental health disorders. And so that also needs to be addressed. And then school policies and culture on substance use, so that again, we can create safe environments within the school. Then we have the workplace, and workplace is also an important setting. And as we speak, we have been targeting public sector institutions, but we'll also move to the private sector. So we know that when you have a prevention and management policy for alcohol and drug abuse, then we address the situations that we find in our workplaces. And so within the workplace, we also require employee assistance programs and also brief interventions and referral to treatment, so that the first line of action should be giving somebody a chance to address their alcohol and drug abuse problem rather than interdiction. And then in the community, we also have, we already have policies on tobacco and alcohol within this country. And so community programs aim at enforcement of these regulations so that we can create safe spaces for children. And then the mass media campaigns is also a community program. And then we also have community-wide awareness programs and also entertainment venues. We know that there are so many within our country. So those are also areas to be targeted for prevention. So I would want to call upon those who work in the prevention field that we need to make a shift to move from the reactive way in which we have been doing prevention, where we move from one place to another with no specific kind of outcomes, to shift to science-backed drug use prevention programs in Kenya. And once this document is launched, you will find it in our website. Thank you very much.
Thank you so much, Susan. And thank you to the members for participating. I'd just like to remind you that you can send in your questions, you can ask and we'll clarify for you. I've seen somebody asking to be attended to and to be called. Remember, our toll-free number 1192 is active. Call in for real-time support. So at this time, I'd like to invite a young boy who was trending on social media. He has been able to come up with a poem, and this poem highlights the impact of a substance use, particularly heroin, to the family and to the community. Mr. Hassan Ichano is a class 4 student at Inspiration Primary School in Mombasa County. Karibu sana, Bwana Hassan.
Sana zo salamu jamani, habari zenu kwa ndugu Waislamu, assalamu alaikum yenu. Na ndugu wa Bwana Yesu asifiwe, Yesu wenu. Janga la mihadarati limetushinda wa Kenya. Majina yangu kamili Hasani wa Mwagarashi. Garashi ni la asili, Hasani ndo wakilishi. Na hapa nimewasili, liko ndiko naishi. Janga la mihadarati limetushinda wa pwani. Janga la mihadarati limejaa duniani. Tumekosa mikakati ya kulimudu nyumbani. Yuwapi wa katikati asaidie jamani. Janga la mihadarati limetushinda wa pwani. Twaupoteza wakati kulaumu majumbani. Eti baba katibuti kuwatunza ikhwani. Ilhali wenye noti mwajua mwafanya nini. Janga la mihadarati limetushinda wa pwani. Sisemi wenye visenti na wale wenye vipeni. Nasema wenye na noti wajua wafanya nini. Watufanya virobati kutulisha heroini. Janga la mihadarati limetushinda wa pwani. Ukiwaona na suti wallahi utoamini. Guuni uone buti utoamini machoni. Tadhani afanya poti kumbe auza kokeni. Janga la mihadarati limetushinda wa pwani. Hao ndio vizingiti Kenya hadi Marekani. Wana nyumba za mabati mijini na mashambani. wamwaga mihadarati kwa vijana mitaani. Janga la mihadarati limetushinda wapwani. Maswali kila wakati twajiuliza nyumbani, madawa mihadarati anayeleta ni nani? Hawa wana harakati kwani wanajua nini? Janga la mihadarati limetushinda wapwani. Kushuti na mama beti washindwa wafanye nini? Kwani hawana bahati watoto wala kokeni. Wamelegea magoti kulala vichochoroni. Janga la mihadarati limetushinda wapwani. Wazazi kujizatiti kumuokoa Shabani. Wanamlisha karoti Sheba ataka ole mdamu kotieni. Hawajui katika hati wala chochote. Janga la mihadarati limetushinda wapwani. Vile kwenye kabati vinaisha majumbani. Naenda kuuzwa 40, 20 au 30. Shabani wala juzi kukosa radhi nyumbani. Janga la mihadarati limetushinda Wakenya. Shabash.
So thank you so much. Thank you so much to Hassan. That is very inspirational. It actually highlights the need for us as a society to come together and support our people. So this time, I'd like to hand over to our CEO, Mr. Victor Kioma, for the rest of the session.
Well, my intention is to invite our guests to make some statements. Huyo ni mgeni wetu mwingine ambaye alika hapo kwa sababu he's been trending in the social media. And in our view, he has a message that requires to get through. We thought if we were so involved in this, he will reach out to us many Kenyans. And we want to invite our young young people, young wale watu ya manoti hawa ndio wametuharibu. And indeed that is the truth. Sisi tunapigana na wale watu wako kwa madeni in the dens. People train in the dens. Ya tunapigana na watu wa maskani na wale wa mapeni wanaendelea kujitajirisha kwa sababu ya kuangamisha vijana wetu. I think hiyo ndio shida tuko nayo. So without much ado, I want to take this opportunity to invite some of our guests here to greet us and make some comments. And I want to start by our partner, Dr. Just greet us and say something.
Thank you very much. Chief Officer of Medical Services. Thank you for inviting me to CEO. Mombasa County is a partner with NACADA, the Community Rehabilitation Center. And I think we've been working very well together. And this fight, as you rightly put it, for a CEO, does not take one or two people. It's a fight, and that's when we can actually win this war. For Mombasa, I think we have a number of methadone or medically assisted therapy centers, and we're also two two main things that maybe I would like to say here is we are on our third reading of the Mombasa County Drug and Substance Abuse Control Bill. And we want to change to say that when a drug addict is actually caught, should actually go for rehabilitation and treatment, not to be criminalized. That's one of the main things in our bill. And we've also added harm reduction in our bill. The second thing is we are working on a sustainability business plan together with all our stakeholders, so NACADA as well. Together, we want to actually some of the things that we're working with NACADA is those cases that are stable in our methadone programs are actually going to NACADA Miritini Center to actually go into the programs of apprenticeship and all. We've already started that. And we are our sustainability business plan will bring in also the private sector. So we're saying let's not just look at this as public sector, but we want to do a public-private partnership. So thank you very much. I'm not going to take too much of the time, but asanteni sana and Mombasa County.
Thank you very much, Daktari. And I want to be on record as appreciating the kind of partnership that we have enjoyed with Mombasa County. And indeed, we want to move on this journey together. We particularly the issue raised about the law. I think that's an issue we are also as an authority raised with the ongoing process of making the law. And what our position is, should be a very clear distinction between the people who are trafficking and the victims. So that we are clear about this. That is our chair. Please welcome us and give you a statement on behalf of the authority.
Yes, the Principal Secretary, Ministry of Interior and Coordination of National Government, represented here by Mr. Arthur Osia, who is the Secretary, National Administration, Ministry of Interior and Coordination of National Government, the representative of UNODC, who is Dr. Fayaz, who is the Head of Health and Social Development, Pillar UNODC, Regional Office. We have also just heard from Dr. Khadija Shikeli, a good friend of mine, who is the County Chief Officer, Medical Services in Mombasa. We also have the Chief Executive, NACADA, Victor Okioma, Madam Farida, who is a member of the NACADA board, all the invited guests, ladies and gentlemen, and all the staff who are here. Good morning, I think it's still good morning. It gives me great pleasure to join you here today and the entire world in commemorating the International Day Against Drug Abuse and Illicit Trafficking, in brief called IDADA. On behalf of the Board of Directors, Management and staff of NACADA, I welcome you all to this celebration and thank you most sincerely for honoring our invitation. My sincere appreciation goes to our chief guest, the Principal Secretary for Interior and Citizen Services, for finding time from his very, very busy schedule to grace this occasion. Your presence, sir, is not only an encouragement to all those involved in the war against alcohol and drug abuse, but is also a very strong statement on the government's commitment and leadership in the fight against drug abuse and illicit trafficking. My heartfelt gratitude goes to all stakeholders at national and international level who have continued to collaborate with us in realization of the authority's mission, a society free from drug abuse. Ladies and gentlemen, June 26th is a significant date in NACADA's calendar. The International Day Against Drug Abuse and Illicit Trafficking, IDADA, provides an opportunity for us to take stock of the gains made, challenges encountered, and chart a collective way forward in the fight against drug abuse and illicit trafficking. Each year, the UNDC gives a theme that forms part of IDADA commemoration. I'm particularly pleased by this year's theme,
share facts on drugs, save lives. As it emphasizes the importance of sharing information to enable all people make informed decisions. Our children, our youth, and all members of community require factual information to enable them weigh the best option between taking drugs and abstaining, and between continuing in drug abuse or seeking for help. As such, information and knowledge is a key determinant of a successful campaign against alcohol and drug abuse. Ladies and gentlemen, as the lead agency in the fight against alcohol and drug abuse in the country, NACADA is coordinating the country's multi-sectoral response to challenges of alcohol and drug abuse and has designed programs to promote healthy lifestyles such as abstinence and responsible parenting. Our mandate is anchored in the National Authority for the Campaign Against Alcohol and Drug Abuse Act of 2012 and the Alcoholic Drinks Control Act of 2010. Further, we leverage on the legislation of other government ministries, departments, and agencies who are well represented in the board to effectively respond to the complexity of alcohol and drug abuse in the country. In reducing the demand for drugs, we have achieved much through the positive parenting program. This is a program that targets parents and empowers them with the knowledge on drugs and how to help an affected member of the family. And it was very well explained by one of the directors, Yvonne. The Life Skills program, which has been piloted, is in over 84 primary schools, has empowered young pupils with knowledge on alcohol and drugs, and also elicited good debate on drug use amongst pupils and teachers. In addition, implementation of the workplace prevention program continues to assist public sector organizations design and implement preventive and mitigative programs on alcohol and drug abuse for their staff and families. To assist public sector institutions to undertake appropriate preventions, NACADA has conducted trainings for alcohol and drug abuse committee members from various agencies. To mention but just a few, we have worked with Kenya Ports Authority, NTISA, Maseno University, Kenyatta University, and Kirinyaga University. In addition, NACADA has provided technical assistance in conducting baseline survey that inform basis of prevention and mitigation interventions in the workplace. These surveys have been conducted in institutions such as the NSSF, Kenya Rural Roads Authority, Kenya National Highways Authority, and Communication Authority. Ladies and gentlemen, on treatment, we pride ourselves in providing a conducive environment for the treatment and rehabilitation professionals to design and implement care and support programs for the affected across the country. NACADA has supported 10 counties, that is Bomet, Kisii, Kwale, Mombasa, Nyeri, Kisumu, Kakamega, Taita Taveta, Nakuru, and Lamu, in establishing county-based treatment and rehabilitation centers. This has been critical in enhancing the uptake of treatment services at the local level, and it is the commitment of NACADA to see that all the 47 counties operationalize such facilities. Additionally, the regular training of treatment and rehabilitation professionals including their certification, has ensured that the country has a pool of resource persons to provide evidence-based interventions to persons with substance use disorders. These professionals are certified upon successful completion of the International Universal Treatment Curriculum coordinated by NACADA. To further strengthen access to care services, NACADA, through the support of our parent ministry and other key stakeholders, has operationalized the Miritini Drug Rehabilitation Center in implementation of the presidential directive, which was issued on 28th August 2015. Through Miritini, NACADA is providing medically assisted therapy and counseling to both in and out patients. So far, more than 200 clients have benefited from the program, which has been instrumental in addressing the hopelessness associated with drug dependence. Through the program, more hands and brains have been released to the market as rehabilitated persons have joined structured employment and entrepreneurship endeavors. We are currently looking for partners to support upscaling of the training program, which is positively contributing to the country's economy. On supply suppression, we continue to work with other relevant government agencies to carry out enforcement activities to suppress the supply of drugs and substances of abuse. We appreciate the support the parent ministry in gazetting the National Alcohol Control Committee. This is a committee that provides a platform for a whole government approach in addressing the many challenges of drug abuse. In addition, through the intervention of the parent ministry and Intergovernmental Relations Technical Committee, NACADA is currently licensing import and export of alcoholic drinks, thus strengthening control measures in the alcohol industry. Ladies and gentlemen, though much has been achieved, the challenge of alcohol and drug abuse is huge, and a lot of work remains to be done. The COVID-19 pandemic has also worsened the drug situation in the country, as we have witnessed increased incidences of drug abuse, particularly in homes, in the presence of children. We have also observed operations of bars where many clients are allowed to drink in closed bars in total disregard of government guidelines. We have also noted that there is an upsurge of online sale of substances, which further exposes young people to the risk of drug abuse, as there is ease of access. To address these COVID-related challenges, the authority is working with all key players, including the Ministry of Interior and Coordination of National Government and other security and law enforcement agencies to address related offenses. Ladies and gentlemen, as I close, allow me once again to thank all partners and stakeholders who have joined us in their various capacities to commemorate this day. I wish to remind all of us all that the challenge of alcohol and drug abuse is multifaceted and requires a multi-sectorial approach. NACADA alone cannot do it, so we appreciate the support of all the partners. I therefore invite you to partner with us in reaching out to all in the society. We are open to work with all like-minded institutions and individuals towards the realization of a society free of alcohol and drug abuse. Should you require any assistance or information, do not hesitate to call our toll-free line 1192 for help. Thank you. Yeah, back to you, Chief Executive.
Thank you, Chair, for stating our position as authority. Those are the challenges that we face. Those are the milestones that we have achieved. The chief guest, our concern, and we want your support in this, is that we still have many county governments that are generating a lot of resources from their licensing function, but they are not plowing it into ADA programs and rehabilitation facilities. I want to appreciate the 10 that we have worked with, and actually maybe correct the impression that might be created, the fact that we have done one in Lam. What we have done in Lam is we supported the equipping of the Red Cross facility in Lam. And I guess on honor, this support that we are continuing to receive from you, especially the licensing, the gazettement of the National Alcohol Control Committee, is helping us to try and put sanity in that sector. Because like not long ago, we have very many applications for licensing of manufacturers, and many of them do not qualify. So it has started to help us put some order in that sector. Having said that, it's my pleasure now to invite the UNDC representative, Dr. Faisal, to make his remarks.
Thank you, CEO, thank you, Chair, and ladies and gentlemen. I wish you a very good morning, and I'm deeply honored today to be amongst you to convey to Kenya the message of the Executive Director of the United Nations Office on Drugs and Crime, Ms. IDADA, on the occasion of this International Day Against Drug Abuse and Illicit Trafficking. I quote, in 2020, an estimated 275 million people use drugs and over 36 million suffered from drug use disorders, according to the UNODC World Drug Report. Drugs are destroying health and stealing futures. With drug use alone killing almost 500,000 people in 2019. Awareness of risk and access to evidence-based treatment and care can help prevent such tragedies. The COVID pandemic has shown us the vital role of trustworthy scientific information and the power of community in influencing healthy choices. We must urgently leverage this potential to address the world drug problem. The theme of this year's International Day Against Drug Abuse and Illicit Trafficking is Share Facts on Drugs Saves Lives. Highlights the need for evidence-based approaches to equip the public as well as health and service providers and decision makers with the tools to inform choices and effective services. Health and safety depends on reliable information. Over the last 2 decades, cannabis potency has almost quadrupled in the United States, while doubling in Europe. But the percentage of adolescents who perceive regular cannabis use as harmful has decreased. So this is serious. On one side, the potency of the drug is increasing, and on the other side, the perception that cannabis is not harmful is decreasing. So this is a matter of concern for all of us. We need to fill the gaps in trusted public information with greater investment in health, science, and data. Worldwide, only 1 out of 8 people in need of drug-related treatment receives it. And new HIV infections among people who inject drugs are not declining. Government needs to expand evidence-based prevention and treatment programs, as well as monitoring and early warning mechanism to help lower income countries detect and counter youth substance use trends. Let us make verified information our ally as we address the world drug challenges with shared responsibility and advance towards a vision of health for all, unquote. So now I would like to take this opportunity to congratulate NACADA, everyone working, including the CEO, the chair, the members of the board, on the national prevention standards that is about to be launched. And I understand that it is based on science, which is very good. It is based on evidence, because we know very well what works and what do not work. And at the same time, it is guided, it has been guided by the international standard by WHO and UNODC. Drug abuse is a multi-dimensional problem, and it needs a multi-dimensional approach. So we have, I can see that it is a multi-dimensional approach that NACADA has adopted with all the multi-sectoral partners around this table to join us in this discussion. So I'm very pleased to hear about this, and I'm very pleased to see that NACADA is moving in the right direction. Thank you very much. Asante di sana.
Thank you very much for those comments and the greeting from the director. I think it's now my pleasure to invite our chief guest to make his remarks. And
thank you very much, Victor. My name is Sausia. I'm Secretary in charge of National Administration at the Ministry of Interior. I'm here on behalf of Dr. Karanja Division. So I want to start by remarks. Just put it, maybe say a few other words later. Speech by Dr. Karanja Division. Yes, Secretary of the Department of Interior and Citizen Services. On the occasion of commemoration of the International Day Against Drug Abuse, representative of the Executive Director, Faisal, the Chairman, Board and staff, ladies and gentlemen, it gives me great honor and privilege to join you and the entire world as we commemorate the International Day Against Drug Abuse and Illicit. In its 33rd year, IDADA commemoration provides nations with an opportunity to reflect on the negative effects of drug trafficking and abuse in the community, and to evaluate the measures taken to address the specific challenges. Our participation as a nation in today's celebration demonstrates our commitment and the contribution to the world drug problem, to which Kenya has experienced its share of harmful effects. The effects of drugs to enable people make informed decisions. Misinformation and myths available care. Ladies Global trends indicate an upward trend in the abuse of drugs and a shift from traditional substances to amphetamine type stimulants, new psychotropic substances, and synthetic cannabinoids. According to the World Drug Report published by UNDC in 2020, about 269 million people, which translates to about 5.3% of the global population, 15 to 64 years, have used drugs at least once in their lifetime. Out of this, 35.6 million suffer from drug use disorders, thereby increasing the disease burden. In 2009, the number of persons who have used drugs at least once in their lifetime was 210 million. It shows there is a steady increase in the number of persons using drugs, hence an increase in the number of persons requiring treatment, care, and support. The COVID-19 pandemic has further compounded the situation through increased stress levels, with more people getting into drug use during containment period, while many others have progressed. A lot of context is the most abused substance with 12.2% persons aged 15. The local context is not much different. According to a national survey conducted by IDADA in 2017, alcohol is the most abused substance, with 12.2% of persons aged 15 to 65 being active users of alcohol. This is followed by tobacco with a prevalence rate of 8.3%, miraa 4.1%, and cannabis 1.0%. Noting that drug abuse was rampant amongst the youth, IDADA in 2016 carried out a survey on the drug situation in secondary schools, which showed that 23.4% of the students had ever used alcohol, 17% had ever used miraa, 16.1% had ever used prescription drugs, 14.4% have ever used tobacco, 7.5% have ever used cannabis, 1.2% have ever used heroin, and 1.1% have ever used cocaine. Arising from the secondary school survey findings, it was clear that by the time children joined secondary, some were already initiated in drug abuse. Based on this realization, IDADA in 2019 sought to establish the extent of drug abuse among its primary school pupils. The survey report revealed that 20.2% of primary school pupils had used at least one drug or substance abuse in their lifetime. In addition, the report outlined that the average lowest age of onset to drugs and substance abuse is 4 years, and the median age of initiation is 11 years. Further, the findings pointed to the role of adults in children initiation to drug use, as 29% of the pupils reported that they get drugs from shops or kiosks near their schools, 26% from bars near schools, and 14% from school workers. On this, my ministry regularly conducts compliance checks to ensure adherence to the 300-meter rule as provided in section 12.1 part C of the Alcohol Drinks Control Act of 2010. Ladies and gentlemen, the above statistics point to the dire situation that our country is in and the need for continued prevention and mitigation of drug abuse. In addressing the country's drug challenge, my ministry through IDADA has adopted a multi-pronged approach that addresses both demand and supply side of the drug problem. The focus of the campaign for a society free from drug and substance abuse is in public education and advocacy. In this connection, NACADA has rolled out prevention programs targeting schools, families, workplaces, and communities with an aim of providing the people with information and knowledge on alcohol and drug abuse. Other advocacy programs include public sensitization, training of professionals, community engagements, and coalitions to spearhead community response to the negative impact of drug abuse. On treatment and rehabilitation, NACADA has rolled out guidelines to facilitate evidence-driven treatment and rehabilitation of persons with substance use disorders. The authority is working with the Kenya Bureau of Standards to formulate standards to be used in the management of drug addiction in the country. Among others, the standards will ensure that affected persons have access to quality support services for their eventual psychosocial development and reintegration. Operationalization of the Miritini Drug Rehabilitation Center is a major achievement that my ministry is proud of. The project coordinated by NACADA was born out of a presidential directive in 2015 and is currently providing a wide range and thereby requires the involvement of all persons. I call upon all stakeholders in the public and private sector to take a proactive role in addressing the challenge of alcohol and drugs, particularly among the youth who are drivers of this economy. I particularly appeal to the county governments to make use of funds collected from liquor licensing to support prevention programs and to put up treatment and rehabilitation facilities in their counties for effective prevention, control, and mitigation. And additionally, I implore counties to support law enforcement agencies in carrying out regular enforcement operations in their counties to enhance compliance. Ladies and gentlemen, as I conclude, I wish to reiterate on the relevance of today's theme: share facts on drugs, save lives. It is upon each one of us to ensure that communities are well informed on the effects of drug abuse and the availability of support services. The theme also challenges us to continuously carry out research and gather intelligence on emerging trends, as well as the new innovative ways of trafficking drugs. I wish to thank the board and management of NACADA for organizing this event despite the challenges posed by the COVID-19 pandemic. My appreciation also to the Eastern Africa Regional Office of the UNODC and other partners for their support. As I close, it is my joy to recognize the efforts of the many individuals including Hassan, who passed to us a very powerful message this morning, and institutions that have worked tirelessly to make the commemoration of this year's IDADA a success and to continually address the plight of persons affected by drug abuse. Thank you, and may the Lord bless all of you. Dr. Engineer Karanja Kibicho, CBS, 26 June 2021. Thank you.
Thank you very much, our chief guest, for those very encouraging words. And you have been very, very articulate in trying to bring out the context and the challenge that we are facing as a country in terms of trying to respond to the menace of drug abuse in the country. We have received a lot of support from various partners in this, but I want to, pick out for mention the support we got from UNODC. The entire week we have been in the media, and that was because of the support we received from the UNODC. And we appreciate Faisal as this message to the regional office that we do appreciate. I know that the Nyanza region was also supposed to be organized in region. I hope they do. And I can see here, as we are talking, there are some people raising their hands. I don't know whether you monitored them. Are you able to call one or two to raise issues? Maybe they want to advise on what we need to do. Anybody who? As those who are organizing for the ceremony, the small ceremony here, are being ready. If there's anybody who wants to ask some question from there, I can see people are coming in and leaving. Facebook has. Yeah, there's somebody who is recording there that he's been out of abuse for 6 years, which is.
We have given permission to Green Corporation.
Yeah, let them speak.
Good morning. Can you hear me? Or good afternoon, rather.
No, is it afternoon?
No, it's still morning. Yes. Good morning. Yes, I am a lawyer and entrepreneur. I take this opportunity to congratulate NACADA and the Ministry of Interior for the tremendous good work it has done in stemming the alcohol and drug abuse menace in the country. I am hopeful that NACADA will reach out to those of us who are in the private sector to assist in building and hopefully promoting rehabilitation centers. My question is to any member who is present currently, because I have listened keenly to all the presentations, and the key point which has been raised is for the need to make a shift to relying on facts which are backed by science. So according to me and the sector in which I am hoping to get into, it's to do with the industrial hemp, which is used in construction, making of textiles, manufacturing, and CBD medication, some of which has recently been found to be effective in treating heroin dependence. So what steps has NACADA taken to differentiate between industrial hemp and marijuana? Because personally, as Green Corporation, we have never and will never advocate for recreational use. All we want is the industrial use of the industrial hemp. So what steps is NACADA willing to put in place moving forward to be able to differentiate between the two and unlock the great potential of these plants? Thank you and have a blessed day.
Just responded by saying that as the law stands now, we allow marijuana that you want to hemp or whatever, as we only allow it for purposes of medical and scientific. I know that there is a room within the legal framework to come up with a proposal for, around use of marijuana for other purposes that must be considered by a board, which was actually supposed to have been created under that law, but has never been operationalized. And as you are aware, there's been an ongoing process of amending the Narcotics and Psychotropic Substances Act. I think those kind of presentations would have been very, very relevant if they were channeled through that process so that we are able to provide for it within the law. As it is for us, we can only address the issues of marijuana for purposes of medical and scientific purposes. As for any other reasons, we can only make application. Hope that under this new process, we will operationalize the what was meant to consider this kind of applications. That's all I can comment. Any other application? Yes, let's see.
Colin Keboy, please go ahead.
All right. I want to affirm to the facilitators for the good things they have done to us. That for the case of the issues of the policy, it has not become very clear because currently you find out NACADA imeluzi touch kitambo because those action plans they used to take is not now taken into consideration because the function of NACADA, the way it used to do sometimes taking the charge in terms of actions for those people who are breaking the law, are not now, they are clueless. Yeah, I can say that because the policies are there, but the county government, there is that disconnect between the county government and the national government, especially when implementing projects and policies framework that is within the line of the drugs and substance. So my concern is this: what are we going to do as a stakeholders and partners to ensure that the NACADA we used to know in the past is coming it comes into action and to implement the program the way it was? Because currently you see some of the county government have used their enforcement officers to implement some of the projects, but the NACADA itself is not working. It's not taking the same action the way it used to do. Number two, 15% of the revenue collection is not used intensively with the county government because we expected the young people to be empowered, the rehabilitation centers to be constructed, and even much more, we create more opportunities for the young people in terms of economic empowerment. Thank you.
Thank you, Collins. I think NACADA of those years and the NACADA of today is the same. We may be operating under different challenges. Of course, you also know that there's a new constitution that evolved some of the functions that we used to undertake. What is left for us is basically to make standards and policies and regulations. Otherwise, a lot of the work is supposed to be done by the counties. Actually, the money they raise from the licensing function is meant to be ring-fenced to support the ADA programs and build rehabs and carry out campaign work. I know there's been a big challenge in that area. For us from NACADA, we are continuing to engage the counties to realize that they have a mandate and they should invest more in ADA campaigns and do rehabs. And we'll continue to engage them. That is all I can say about the issues you have raised. And I think now we should proceed to the next step. Yes, we want to launch the guidelines. How does the guest stand so that the sorry. Chair, we have to sit here. And the chair and the chief guest. Where are the cameras?
This side.
Oh, sorry. Okay. The cameras, I think they want you to stand there. Chair, stand there. Stand there. Put your hand there. Your hand there.
You have to find somewhere.
I am here. I am here. So, tuendelee. Kati hiyo kitu cha nao ushike pande hiyo. Na yeye ashike pande hii. Yeah. Hata hiyo imefungwa na. Na muangalie pande hii kamera ione. Where is the coffee?
Hard copy. Yeah.
But you know the color had
Director, what? I like the smile.
concentration. The concentration of this one.
I am told that the printing is still going on. Yeah, we will deliver these copies.
It's good that they have the mask.
Yeah.
It says something. It carries a message.
Very good.
Gender sensitive. There is
Yes, don't do it.
Maybe are we doing soft copies as well?
Yeah.
Flash disk and this is important. Yeah.
So where do we go from here?
Congratulations.
So now we hand over to PCS for the closing remarks.
Okay, let's sit and hear the closing remarks.
Congratulations.
It's very nice. Yeah.
Madam.
Chief guests, ladies and gentlemen, all protocols
There's nobody near you.
all protocols observed. On behalf of NACADA, my name is Patrick Obura. I'm the director in charge of corporate services. I want to take this opportunity to appreciate, first of all, starting with the PS State Department of Interior and Civil Services, represented by SMA, for having gotten time to grace this occasion, the IDADA 2021 commemoration. We also want to appreciate UNODC, represented by Dr. Faisal. Asante sana. We also want to appreciate our board of directors, represented by the chairperson, Professor Mabel Imbuga, as well as Mama Farida. Asante sana. We also want to appreciate the county government of Mombasa, our key stakeholder in this struggle. And again, the NACADA team, led by our team leader, Mr. Victor Kioma, for the guidance that enabled this event to actualize, and specifically the Directorate of Public Education, Advocacy and Rehabilitation, for putting the bits and pieces to enable the commemoration to actualize. We also shukrani zetu za kipekee, mabibi na mabwana, pia zinaendea Bwana Hassan Chano kutoka Likoni kwa kuweza kupata nafasi ya kuhudhuria hizi sherehe za IDADA 2021. Asante sana. The NACADA family, both present here and also following from online channels. The other members of the public following through our online channels, we take this opportunity to sincerely appreciate your participation in this event as we package or as we bring this commemoration to close, we are cognizant of the fact that the problem is still with us and our target seems to be moving. So the struggle continues. As we live here, we the theme of the 2021 commemoration that says we share facts on drugs, saves life. Thank you very much, and I want to take this opportunity to request Rita to bless with a word of prayer. Asanteni sana.
Na tuombe. Tuombe Mwenyezi Mungu mwenye kuneemesha sisi kidogo kidogo na kuomba. Na sisi ni waja wako dhaifu, tunarudi kwako, tunakuomba utuondolee janga hili liloingia ndani ya darasa wetu. Na tuhifadhi na maradhi haya yaliyoingia. Hatuna mwenye kumtegemea isipokuwa ni wewe Mola wangu. Tusome alhamdulillah rabbil alamin arrahmanir rahim maliki yawmiddin iyyaka na'budu wa iyyaka nasta'in ihdinas siratal mustaqim الموضوع amin. Ongeni. Tunasema amin pamoja, tushaomba, tunasema amin, tukubaliwe.
Amen.
Amen.